Welcome to the Smart Tips for Stroke Care series. This topic of smart tips will cover positioning in a chair or wheelchair after stroke. Smart Tips for Stroke Care is a guide that explores 15 different topics related to stroke. It highlights common changes due to stroke and strategies for managing these changes. You can find the complete guide on the Core Health Ontario website and the educational videos on the Central East Stroke Network website. After a stroke, a person's ability to move and position themselves can be difficult. This may increase their risk for falls, injury, pain, skin breakdown, and even responsive behaviors due to frustrations, discomfort, and inability to move themselves. It can impact their ability to spend time out of bed and participate in activities they enjoy. For more information related to changes in behavior after stroke, refer to the Smart Tips for Stroke Care guide. It is important to know that many persons with stroke may experience pain and changes in muscle tone. Development of shoulder and arm pain is common, and the arm should always be well supported while sitting to help prevent pain. Proper positioning of the person will increase their comfort and safety. Use of equipment should be specific to the needs of the person. A stroke can also cause a lack of sensation on one side of the body, so it is important to monitor the person's skin for signs of breakdown. Skin breakdown can happen when the person cannot feel pressure, wetness, temperature, and the effects of pain. For more information on the hemiplegic arm and hand after stroke, see Smart Tips for Stroke Care guide. After a stroke, the person's sense of where their body is in space can result in poor positioning of arms, legs, and the trunk or torso. Additionally, the trunk or torso and one side of the body can be weaker, known as hemiplegia, which can make it difficult to stay centered and in the best sitting position. Remember to always follow the care plan at your facility. This section will provide tips on how to position a person in the chair or wheelchair after stroke. Before starting, make sure the person is wearing safe and suitable footwear that will not slip off, such as closed heel, closed toe, non-slip sole, that are all well fastened. Ensure you have the necessary equipment available and ready to apply, and that the seat is clear. Some examples of equipment include a lap tray, footrests, and a seatbelt. Be sure that the wheelchair is in good working order, the brakes are on, and if required, footrests are attached. Once the person has transferred to the chair, be sure the hips are all the way back in the center of the chair and that knees and hips are level. The person's trunk should be centered in the chair. Check that the feet are flat and directly under the knees and safely placed on the floor or footrests. Make sure that the affected arm is well supported. Use pillows or positioning devices as recommended. The arm should be slightly away from the person's side with the hand forward and palm down. Before you leave, ensure that the person is well supported and comfortable. Do frequent checks to make sure they remain properly positioned. Always seek extra support when required. Occupational therapists and physiotherapists are skilled in proper sitting and positioning. It may be helpful to involve them in the person's care. There are many options to customize the seating system, and help is available. For more information on Smart Tips, including other topics related to stroke, visit the Core Health Ontario website.